Thank you for being here. Thank you all for coming. My name is Doris Matsui, and together with my colleagues here and my colleague here, Jan Schakowsky, we serve as co-chairs of the Congressional Task Force on Seniors. As we know, yesterday, the Republicans unveiled their budget plan for fiscal year 2012. They are actually marking that up now. My reaction to it is absolutely stunning. Stunning because, quite frankly, it attacks the very fabric of what we believe is important in this country, and particularly for seniors. You know, we look after each other in this country. That is really the mantra of the middle class. We think about each other from generation to generation. And we have a value system as Democrats that really do promote that. And we are here today to let you know, the American seniors, that Democrats are standing with them. And we will stand with you to ensure that the Republicans do not balance their budget on the backs of our seniors. We will not sit idly by when Republicans attempt to annihilate Medicaid, or they try also to put in place and almost immediately trigger for Social Security cuts. You know, this might be their so-called new plan, but we've heard this all before. In 2005, when the Republicans laid out their plan to privatize Social Security, remember that? The American people said no. That foresight really saved seniors trillions of dollars that would have been lost as a result of the stock market crash. Now, 6 years later, not that long, but 6 years later, the Republicans want to privatize Medicare. And the American people are once again saying no. They're saying no because they know that privatizing Medicare and cutting benefits does not eliminate the deficit. It does not create jobs. It only hurts Americans' seniors. In my district in Sacramento, California, 94% of seniors use Medicare to see the doctors and get the care they need and they deserve. 17% of Sacramento seniors receive Medicaid. These seniors, who receive an average of less than $15,000 a year in Social Security, earn benefits, often their only source of income, cannot gamble with vouchers, and they cannot afford the proposed cuts. The numbers alone show how short-sighted the Republican plan really is and how much it will shortchange America's seniors. So we invited you all here today to hear about how it would affect America's seniors. We'll hear first of all from our congressional leaders who will highlight what is at stake here in these proposed cuts. And then we'll hear from leaders of organizations whose members will be directly affected by this legislation and will be fighting to make sure that this bill does not become law. And then we'll take questions. So thank you again for coming. And please join me in welcoming a true champion for America's seniors, my friend, my colleague, and my co-chair on the Senior Task Force.
Thank you. And Congresswoman Jan Schakowsky, I represent the 9th District of Illinois. I'm honored to be here today with my co-chair, Doris Matsui, on the congressional leaders and the advocates who will talk about the budget proposal released yesterday. Well, make no mistake about it, the Ryan budget is a war on seniors. Newt Gingrich has said we should, quote, let Medicare wither on the vine, but this Republican budget would chop it down at the roots. Republican attacks are coming from many fronts. First, the Republican budget repeals the Patient Protection and Affordable Care Act, and gone are the improvements that we made to Medicare, like annual physical exams and personalized wellness plans, and back comes the donut hole, leaving seniors to pay thousands of dollars out of their own pockets or go without the drugs that they need. Eliminated are the protections for low-income seniors, quality improvement, and for quality improvement for nursing homes, and resources to stop elder abuse. Second, the Republican budget destroys Medicare as we know it. Gone are guaranteed benefits, and gone is the ability to pick your own doctor. The Wall Street Journal made it very clear, said the Ryan budget, quote, essentially ends Medicare. The CBO says that under the Ryan budget, the average 65-year-old would pay 68% of the total cost of their coverage for health care. That's premiums, deductibles, and other out-of-pocket costs compared to the 25% that they would pay under the current law. Third, the Republican budget slashes and caps federal Medicaid spending, the primary source of long-term care for seniors. It is also, of course, a program for the poor, but I think people forget about how it pays for nursing home care and other long-term care. As my governor and many others wrote on Monday, this is from Governor Pat Quinn, he noted that the states will be forced to pay all costs once the annual cap is hit, right when baby boomers are retiring and they're facing steep increases in health care and long-term care over the coming decades. The governors say that the Ryan plan's funding shortfall would force an, quote, untenable choice, unquote, for the states to hike taxes, cut other important programs, or slash eligibility, benefits, or payments to providers. These governors write, quote, we need federal policy that creates cost savings, not cost shifting, unquote. Finally, the Republican budget opens up a front against Social Security, setting the stage for Ryan's plan to cut benefits and raise the retirement age. The Ryan Republican budget principles are simple. Here they are. Make seniors pay much more for less while enriching private insurers and drug companies. And put greater financial burdens on seniors whose median income today is below $19,000 a year, while refusing to raise taxes on the wealthiest of the wealthy, and continues to allow billions of dollars in tax cuts for oil companies and companies that outsource jobs overseas. The Republicans are literally trying to kill Social Security, Medicare, and Medicaid. Democrats will stand in the way of their war on seniors. I would like to now bring up Henry Waxman, the former chairman and current ranking member of the Energy and Commerce Committee, and someone who for many years in this Congress has been fighting to advance benefits and help our elderly in America.
Thank you very much, Jan Schakowsky. I'm pleased to be with my colleagues at this event to talk about what the Republican leadership budget can do to seniors in this country. They seem to hate government so much that they say they want to shrink government. Well, the first thing they want to do is shrink government's responsibility to people who look to the government for their help. Seniors, we know what happened before Medicare. Seniors was the group that was fastest growing in terms of being in the poverty camp. Without Medicaid, which serves specifically low-income poor people, we would let the safety net be so ripped apart that people would fall exactly to the bottom. Without the benefit of these programs as part of the social contract in our society, we will do a tremendous damage to seniors if we went along with this Republican budget. They have some theories. They call themselves the young guns. They're now in charge. They have theories they want to follow. If we could shrink government, then the upper income can keep more of their money. But what they don't understand is what it's like to be older, what it's like to be uninsured, what it's like to be in a nursing home, what it's like to be in a home health care setting. And if you have yourself in those kinds of circumstances and don't have the Medicaid and the Medicare programs to benefit you, to support you, what we would find in our society is a safety net for all of these people would be ripped apart and their human dignity would be ignored. That's contrary to the values of our country. We should not let them experiment on their view of the economy and the full burden, if they're wrong, which I'm sure they are, to be borne by the seniors primarily in our nation. They would end Medicare. They would cut 2/3 of the Medicaid program, leaving the states with the inevitable option of cutting the payments to providers, cutting people out of the safety net system for their health care needs. They used Medicaid as a piggy bank in order to avoid asking the people at the very top of our economic ladder, the very rich in our society, the highest income earners of millions of dollars and more, to avoid paying their fair share of the taxes, and for all of us to look after each other. We're going to fight this Republican budget, and I hope Republicans will reject it as well, because it is so contrary to what Democrats and Republicans all believe, who are not here caught up in this ideology. We will fight for the seniors, and I'm pleased to join my colleagues in expressing that point of view.
Thank you.
And now I want to turn over to Jan.
Oh, sorry. Okay. It's because of John Larson, who is our caucus chairman, that we have a task force on senior issues. He had the vision to understand that of the vulnerable, the seniors were really at the top of the list, given the Republican agenda. Now the veil has been lifted, and we know that it's absolutely true. So we thank you, Chairman Larson, for allowing us to chair this task force and for leading the way.
First of all, Jan Schakowsky and Doris, Matsui clearly understands their passion and their commitment. And it was because they had a deep and abiding concern that the message wasn't getting out there to our seniors, that we needed to mobilize in a way that we hadn't. And it's through their efforts and their hard work and diligence that the entire caucus joins in, along with our distinguished chairs who have supported them along the way, because they understand intuitively what we have to do in order to spread this word across the country. I can say it no better than they. But when it comes to shared sacrifice, in this day and age, when we're at war and we face budgetary constraints with wars unpaid for, in a time unparalleled since the Gilded Age, when the accumulation of wealth is in the hands of so few, that the other side would offer a budget that would balance itself on the backs of seniors and children and people who need to be educated and veterans and their families returning from 2 wars. This is unconscionable. And we will not stand by and see Medicare as we know it, and the guarantee that comes from the common weal of government, that comes from participating and playing by the rules and raising your families in the values that you know someone is going to be looking out for you in your time of need because you have sacrificed. There is no sacrifice called upon for those who have made it well. The middle class continues to be squeezed at this time and only further burdened by this budget that the CBO says will only make the poorer poorer and the elderly without benefits. Thank you, Jan. Thank you, Doris. I join with all my colleagues in support of this initiative. Democrats will stand by the seniors of this country. Democrats will stand by all Americans in this country who rightfully deserve these value-added programs that their government has provided. This is not the time, as Grover Norquist has suggested and Henry alluded to take government and shrink it up so small that you can drown it in a bathtub. The only thing that we're going to drown is these wrong-headed ideas on the part of the Republicans who seek to do harm to our citizens. Thank you so much, Doris and Jim.
Lucille Roybal-Allard from California was an early participant in our seniors task force, but it's years and years that she's been involved in protecting our older Americans. Lucille.
Thank you very much. Let me begin, first of all, by associating myself with the comments that were made by previous speakers about the leadership of Jan Schakowsky and Dora Mitsui on this very critical issue of seniors, and to join in thanking them for having this press conference in highlighting the Republican assault on America's seniors. As a member of the Appropriations Committee, I have gained an appreciation for the fact that the federal budget is about much more than just dollars and cents. It is a moral document that reflects our priorities and our values. The budget that was released yesterday by Representative Ryan is a reflection of Republican values and priorities, and it isn't a pretty picture. At this very moment, in a room nearby, the Republican majority is marking up their new Republican budget proposal. They say this budget is going to be good for America and good for senior citizens who work hard all their lives to earn their retirement benefits. However, the details of their bill reveal a different story. Republicans don't just plan on cutting Medicare, they plan on destroying it. According to a Wall Street Journal article published on Monday, the Republican plan would, and I quote, essentially end Medicare, which now pays most of the health care bills for 48 million elderly and disabled Americans, as a program that directly pays those bills, end of quote. In other words, the Republican budget is not a reform budget, it is a termination budget. Furthermore, the Republican budget plan would transform Medicare from its current format to a privatized voucher system where future health care cost increases get thrown on the back of America's seniors. The median income for a senior is just a little over $19,000 a year. Many will not be able to pay more for health care or the cost of long-term care on their own. And the alleged savings under the Republican budget plan will come from denying medical care to seniors. Just a few weeks ago, Majority Leader Cantor said, and again I quote, "We're going to have to come to grips with the fact that programs like Medicare cannot exist if we want America to be what we want America to be," end of quote. Well, what Democrats want America to be is one that fights for our seniors, not one that robs them of their savings or denies them health care. And Democrats want America to be a country where seniors earn and receive a dignified retirement. That is why Democrats will continue to fight to protect the dignity of America's seniors and from this cruel Republican budget. And now I would like to introduce my senior task force colleague, Representative Ted Deutsch of Florida.
Thank you all for coming here today. Thanks to Congresswoman Mitsui, Congresswoman Schakowsky for your leadership of these issues, Chairman Larson as well. It's good to be here with my colleagues and so many leading advocates on behalf of seniors. Many of us are still trying to wrap our head around the budget plan that Paul Ryan released yesterday. The plan is called The Path to Prosperity. But as I flip through it, I have to wonder, it's a path to prosperity for whom exactly? For seniors, this budget is no path to prosperity. It is a path to the poorhouse. Instead of Medicare, which provides universal coverage to seniors and only spends 3% of its revenue on overhead, the Republican budget gives seniors vouchers to buy private insurance. Now, you can call it premium support, you can call it a voucher, you can call it a coupon, you can call it the golden ticket if you like, but changing the name won't change the fact that this GOP plan will force America's seniors to hand over most of their incomes to private health insurers. If healthcare costs in the private sector continue to rise as they're projected to, the overwhelming majority of Americans' retirees will be unable to afford health care when Paul Ryan begins distributing his coupons in 2022. The GOP plan would cover just 32% of the cost of health insurance plan, as good as Medicare, leaving seniors on fixed incomes with 68% of the bill. According to the CBO, in 2030, one of Paul Ryan's coupons will be worth about $9,700. And health insurance plans as good as Medicare will cost about $30,000. That means that there will be a bill worth $21,000 sitting in the mailboxes of America's seniors, even though Social Security benefits, which they want to cut, will only be around $32,000 per year for a middle-class senior. The Republican budget means a senior receiving $2,500 in Social Security each month will have to spend about $1,700 of it on private insurance. This plan does nothing to control healthcare costs. It just shifts the burden of rising healthcare costs from the federal government to seniors. Now, I also just like to spend a minute focusing on Medicaid. Many probably assume that the Ryan plan for Medicare is just so awful that it will defeat itself. Meanwhile, Republicans are crossing their fingers, hoping that no one pays attention to the crusade to gut Medicaid. Republicans want to characterize Medicaid as some type of welfare program for freeloaders. It's true that this program serves millions of very poor Americans, children who did not choose to be born into poverty, families with permanently disabled kids, and relatives, and yes, seniors. Medicaid is the largest payer of long-term care for seniors in America. 2/3 of elderly nursing home patients rely solely on Medicaid to pay their care. Where does Paul Ryan propose they go? America should be proud that we don't have poorhouses anymore, and we're not going back to that. Congressman Ryan wants to cut Medicaid when the fact is physicians and hospitals can barely afford to treat these patients as it is because reimbursement rates are so low. And compared to the rest of our healthcare system, Medicaid is cheap. In fact, Medicaid's costs per individual are growing half as fast as Medicare and the private sector. It is true Medicaid is straining the federal budget and state budgets, but treating a symptom of high unemployment won't cure the disease. Medicaid is not too expensive. People are too poor. That's why we should be focusing on creating jobs, raising middle-class incomes, and bringing some economic security back to the American people. I'd like to just close by saying that the Republican budget plan is no work of genius. Claiming government savings by giving seniors a coupon and telling them to fend for themselves in America's dysfunctional private insurance market, or eliminating health care for single moms, impoverished infants, elderly patients in nursing homes, and the permanently disabled is not some new, revolutionary, courageous idea. It is simply an abdication of our responsibility to protect our most vulnerable and the health care that they need, and we are not prepared to do that. Thank you very much.
From one end of the country to another, members of Congress understand what the burden would be on the elderly in their districts. We have with us from California, Laura Richardson, from Pennsylvania, Mark Kritz, from Rhode Island, David Ciccione. I'm going to, in that order, ask them to come up and say a few words.
Well, first of all, I want to associate myself with others who have congratulated our co-chairs. They've taken on this issue, and I think they've talked about the secret that a lot of people are not aware of these impacts. I just want to focus on one point. I have 52,000 people who live in my district who are over the age of 65. That's almost approximately 10% of the entire people that I represent. And of those 52,000, about 1/3 of them are raising their grandchildren. So you tell me, what choice do you think the American people want us to take? We agree that we need to do things differently, and many of us are supporting efforts to do that, but not on the backs of our seniors. Those who paid in to Social Security, Medicare, who are receiving these benefits and are dependent upon them, deserve to be able to continue their lives and to receive benefits. Why? So that they don't cost us more. Because I would venture to say without these, what you have is then people who don't go to the doctor, you have more people who are going to emergency rooms, and we will end up paying more and not less. I thank our co-chairs for all of your hard work, and count me in as we continue this fight. Thank you.
Jan, Doris, thank you very much for being co-chairs. I didn't expect to speak today, but I wanted to be here in support because in my district, which is one of the oldest, has the largest senior populations in the country, Pennsylvania's 12th district, we rely on Social Security and Medicare. And I want to highlight that point is that these are folks that without the Social Security safety net, without the Medicare program, would be living in poverty. And that's really what we're talking about, is that we have a Republican majority now that is saying, well, we have to shift the burden to the people who need our help the most. And I think that's really unconscionable. So I'm standing here because, Mr. Ryan, this isn't the America I grew up in. We take care of each other, and what you're proposing is that we cut some people off from a lifeline that they need. So thank you for holding this. I'm here to fight to the end to protect our seniors from these kind of cuts. Thank you very much.
I too want to associate myself with all the wonderful remarks of my colleagues and thank Doris and Jan for your extraordinary leadership. You know, it's often said that you can judge a society by how they treat their elders. And this proposal by Mr. Ryan does not reflect well on us as a country. We have a responsibility to take care of our seniors. This budget shifts that responsibility or advocates that responsibility, and at the same time, looks at and rewards the richest Americans in our country, the biggest oil and gas companies in our country, at the expense of our seniors. It's a budget in so many ways that puts all of the burden, or shifts so much of the burden on those who can least sustain it. But we have a responsibility to ensure that every single senior in this country has access to quality health care, and protecting Medicare and Medicaid are a very important part of that system. This is a proposal to end Medicare as we know it. And I know I speak on behalf of many of our colleagues. We're going to fight to the very end to make sure that doesn't happen for our seniors. Thank you.
We have a lot of partners, not just inside the Congress, but outside. And first, I'd like to ask Max Rickman from the National Committee to Preserve Social Security and Medicare to come up and say a few words.
Thank you very much. Thank you for inviting me to join you today. Let me just start by saying thank God there are members of Congress like the ones here that have been here today protecting the programs we all care so much about. On behalf of the 3 million members and supporters of the National Committee to Preserve Social Security, I'm here to voice our strongest opposition to the Ryan budget plan. A dozen years ago, I remember President Clinton talking about building a bridge to the 21st century. This plan builds a bridge to the 19th century. And the signpost on the other side of the bridge says, "Welcome, you're on your own, and good luck to you." The Medicare provisions in this plan will send our country back to a time before Medicare was enacted, when over 1/2 of the senior population had no health care coverage at all. And the Social Security provisions, which we're just now figuring out, are designed to fast-track benefit cuts through Congress, despite overwhelming public opposition to cutting Social Security. The Ryan plan would replace the current Medicare program with vouchers and leave seniors and the disabled, some of our most vulnerable Americans, hostage to the whims of the private marketplace. Over time, this plan will destroy the only health insurance program available to 47 million Americans. Vouchers are designed not to keep up with the increasing cost of health care. That's how they save money. Beneficiaries would end up at the worst of all worlds. According to the CBO, and I know many of us were shocked to see that figure this morning, the cost of health insurance for Medicare beneficiaries would increase under the Ryan plan. How much? More than double. More than double. The National Committee's mission is to preserve Social Security and Medicare, not just for today's beneficiaries, but for future generations. And our members care about that deeply. Our members have already begun voicing their support for our position opposing the Ryan plan. Starting yesterday, we have began to deliver thousands of letters from our members to all members of Congress. They're being delivered as we speak. These were the result of one mailing. This year, we have received 800,000 petitions, letters, and postcards opposing what the Republican majority is trying to do with this budget plan. We will continue to educate our members. We recently had a teletown hall meeting and had over 50,000 of our members on the phone. Many of you may have heard our radio ads on WTOP last week, this week, next week. We're going to take that on the road. We are going to target congressional districts with similar kinds of radio ads, where members of Congress who support this plan will see what happens when their constituents hear the facts about what this plan will do to seniors and poor people. We will also conduct an extensive information campaign through our social media operation and through our outreach through our grassroots managers and volunteers. The Ryan plan has its priorities all wrong. It asks the poor and the middle class to sacrifice while the wealthy get tax cuts. These are not the priorities seniors voted on last November, and seniors will not forget those who support this agenda. Thank you.
Thank you. From 1985 to 1990, I was director of the Illinois State Council of Senior Citizens, which turned into the Alliance for Retired Americans. And here is the executive director, very proud to introduce Ed Coyle.
Thank you very much. And I too want to thank Congresswoman Schakowsky and Matsui for their lifetime leadership on these issues and certainly for chairing this task force. My name is Ed Coyle, and I'm the executive director of the Alliance for Retired Americans. We are a 4 million member advocacy organization for seniors all across the country. Instead of trying to achieve consensus on federal spending, Paul Ryan dangerously overreaches with a plan that would fundamentally change our nation's values, just not a budget. He would like us to give tax cuts to the wealthy, but turn a cold shoulder to seniors and low-income children who need to see a doctor. It's a plan that takes better care of CEOs and corporate towers than it does seniors in nursing homes around the country. And it hides its cold-hearted details behind seemingly innocuous phrases and buzzwords like premium support program and block grants. So let's take a moment and translate what I call Ryan speak. First, premium support program is a way of saying let's turn Medicare over to the big health insurance companies in this country. With a premium support program, the money goes to the insurance company, not the beneficiary. We know painfully well that when the insurance industry gets to call the shots, they can take much better care of their profits than our health. This is privatizing Medicare, and insurance companies win again. And second, in Ryan speak, is a block grant. This is a unique way of saying that Medicaid should be run by Republican governors across the country. Paul Ryan's block grants would put affordable access to nursing homes and long-term care in the hands of Scott Walker, John Kasich, Mitch Daniels, and Chris Christie. Seniors in those states better pray for good health care. We're going to pay for good health care too if this happens. The Alliance for Retired Americans has 4 million members and 1,400 local chapters around the country. We are immediately setting out on an ambitious plan to tell Americans of all ages, particularly seniors, about just how dangerous Paul Ryan's budget proposal is. We will spend the month of April organizing grassroots actions around the country to try to stop this cold-hearted plan. But we won't stop there. The senior vote will be a highly sought-after voting demographic in next year's elections, presidential and congressional. In the states that will likely decide who controls Congress and the White House, older voters are often as much as one-third of the total electorate. Paul Ryan's budget plan is a sharp reminder of just how important it is that seniors know the issues and where the candidates stand. That is why we will build the largest senior field organization ever assembled. We will have paid staff in the field all over the country. We will build a zone coordinator and a paid and earned media program in all of the battleground states. We will educate seniors by phone, by mail, and in person. We will meet them at senior centers, shopping malls, and Alliance for Retired American events all over the country. To keep America as a nation where we still lend a helping hand to the young and to the old, and to the sick and the poor, we must stop these cuts to Medicaid and to Medicare. Thank you.
Joan Edmacher is with the National Women's Law Center. Women are particularly affected. They live longer, they get lower benefits, and I welcome Joan to talk about the position of the National Women's Law Center.
Thank you very much. I, again, thank you for organizing the task force, for organizing this press conference today, and for recognizing that senior issues are very much women's issues. Women have long been more anxious than men about their economic security as they grow older, and with good reason. They're paid less than men. They do most of the unpaid caregiving. And so they have less money when they reach retirement age. And then they live longer than men and face higher health care costs. But if older women had good reason to be nervous about their retirement security before, with the release of the Ryan budget, they have grounds to be truly terrified. Women rely more than men on Social Security, which provides benefits that they can count on as long as they live. They rely more on guaranteed Medicare benefits and on Medicaid assistance for long-term care and other health expenses. In addition, more than 2 out of 3 poor seniors are women, so older women especially rely on safety net programs, on SNAP benefits, formerly known as food stamps, and Meals on Wheels, on housing and energy assistance, so they don't freeze in the winter or die of heat stroke in the summer. The Ryan budget would devastate all of these programs and more. Other speakers have mentioned what the Ryan budget would do to Medicare and Medicaid, so I won't go into that. They've also mentioned what the repeal of the Affordable Care Act would mean for the additional benefits that were given to seniors. But the repeal of the Affordable Care Act would also mean that these insurance companies, who would now be responsible for providing care to seniors, the majority of whom are women, could go on treating women as a pre-existing condition. Overall, the Ryan budget cuts $6.2 trillion in federal spending. That's a hard number to comprehend. So let's talk about some numbers that women understand all too well. $12,000 a year. That's the average Social Security benefit for women 65 and older, compared to nearly $16,000 for men 65 and older. Not that that's particularly generous either. $4,500 a year. That's the average out-of-pocket spending for female Medicare beneficiaries, compared to $3,900 for male beneficiaries. 7 out of 10. That's the percentage of seniors helped by Medicaid who are women. Women will find it hard to understand how Representative Ryan could think that average Social Security benefits of $12,000 a year are too high, or that they can afford to spend more than $4,500 a year on out-of-pocket health care costs. Women will also find it hard to understand how Representative Ryan could propose slashing programs vital to millions of Americans of all ages, while proposing trillions of dollars in additional tax breaks for the very wealthiest in corporations. Or maybe they'll understand it all too well. Thank you.
The coalition that is coming together to fight these drastic cuts is wide and diverse. I'm glad to welcome Jeff Cruz from Latinos for a Secure Retirement.
Great. Thank you, and thank all 3 congresswomen and members of the Seniors Task Force for your leadership on this issue in the House. My name is Jeff Cruz. I'm the Executive Director of the Latinos for a Secure Retirement Coalition. We launched the coalition earlier this year with 9 leading national Latino organizations, including LULAC, LACLA, Hispanic Federation, the National Hispanic Council on Aging, and others. We represent 1 out of every 6 Americans that are of Latino descent. And when you look at the key demographic changes that are coming over the next 40 years, America is becoming more diverse and America is aging. Our organizations and Latinos for Secure Retirement, we work in our communities on the front line every day. And we know the critical importance of Medicare, Medicaid, and Social Security to our seniors. Therefore, we stand staunchly opposed to the radical Republican budget proposal that would dismantle Medicare and Medicaid, slash Older Americans Act and other discretionary services, and set up an expedited, fast-track process for slashing Social Security benefits. The Republican budget proposal would devastate the most vulnerable Americans, while at the same time providing additional tax breaks for the wealthiest Americans. The Republican plan voucherizes Medicare, forcing seniors to pay higher out-of-pocket costs each and every year. It would slash Medicaid by more than $1 trillion just over the next decade alone, dismantling the social safety net for those that need it most, including 5 million seniors who get assistance for their Medicare premiums, deductibles, or co-payments, and more than 6 million seniors who rely on Medicaid for their long-term care needs, their nursing homes. Now, ironically, because of the effectiveness of Medicare and Medicaid that some of the other speakers mentioned, these proposals actually increase overall health care costs. The Republican budget puts ideology above the needs of hardworking Americans. You cannot balance a budget simply by slashing critical programs for low-income families while ignoring the revenue side. A budget is a reflection of our values, and our values are for caring for our elders, helping families, and looking out for the most vulnerable citizens. We unconditionally reject the Republican budget proposal and its unconscionable assault on hardworking, low-income families that are trying to pull themselves up by their bootstraps. The Latino community is rapidly increasing in size and political power. Our coalition is dedicated over the coming months to educate and mobilize this growing community to protect Medicare, Medicaid, and Social Security. And I'm happy, I know everyone wants to get lunch, but I'm happy to go into more details after this. Thank you, guys.
Thank you so much.